Hey, it is a pink takeover today, for Breast Cancer Awareness Month, and Dr. Moline from Care Northwest is here. You're going to see pink all over the place.
Absolutely.
Pretty much the whole month. And it's a great thing because we really want people to start thinking about, as you said, breast health, not just breast cancer.
Correct.
All right, so let's talk about some of the risk factors that people think about it. You know, I first of all think of family. That's just one piece.
The biggest risk factor is being female and having breasts.
Okay.
And the longer you have breasts, so age is an associated factor. So it'll be far more common in the 80-year-old than in the 40-year-old. And that's where screening comes into effect. Screening means we're looking for something, but we don't know where it is, and we're doing a test to look for things. Screening the 20-year-olds is not any benefit because it'll be one in thousands and thousands and thousands of women. But screening the 40 and over crowd would be more beneficial because it's going to happen more often. That's when it's worth looking for screening.
Okay, but you really still should learn at an earlier age to do self-exams.
It's good to be familiar with yourself. When we ask women who have actual breast cancer, how did you know? How did you find it when they find on self-exam? The only answer really is that it was different. And the only way to know it was different is if you knew what normal was, to be passingly familiar with normal. So if there is a difference, you'll be the first person to know. No one else will know outside of your body as well as you know your own body.
For sure. And we, of course, think so much about mammography, and some people, it's not in their budget.
It is in the budget. It should be almost impossible to find someone who's not eligible for obtaining screening mammography in this decade. There are numerous resources and various clinics around town who serve under insured patients or women with financial difficulties can get you access to that very simply. The BCHP program provides breast and cervical health screening, and insurances are required, even the most basic insurance plan is required to cover screening mammography as a benefit for women.
And that is one of the topics that we can be talking about throughout the morning. If you have a question for Dr. Moline about breast cancer, about breast health, please send them in to us, and we'll be having her joining us on our live stream as well on Facebook. So stick around. Much more to come in just a few minutes. It's now about 6 minutes before 6.